All right, thank you, Chuck. Here we are, 7:34. You and your fam probably getting ready for a perfect vacation, right? A lot of you are going to head to the airport to get there, but flying does some strange things to your body, so we want to talk about that. We've got award-winning cardiovascular surgeon, Dr. David Greuner, joining us to do just that. Thank you for coming in.
Thank you for having me. I'm enjoying the Southern hospitality.
Well, good. I know we're happy to have you. He's in from New York, so we're giving you a big, hopefully a warm Southern welcome.
Absolutely.
Now, we're talking about, the first thing here is DVT, deep vein thrombosis, and I remember hearing about this. I traveled a little bit when I was pregnant, and the doctors talked about it a lot. You don't hear about it a lot outside of that, but you should, right? It's not something that affects just pregnant people.
No, DVT is actually a lot more common than we initially thought, and it's actually about a million new cases being diagnosed in the U.S. right now. And out of those million cases, people that have had DVT in the past have a 33% lifetime risk of having another one. And it was thought that DVT actually didn't contribute significantly to death or basically dismemberment or morbidity, but it's now known that there's a lot of sequelae or secondary results from DVT that actually result in life-threatening illness. One of those is called pulmonary embolus, which is the blood clot breaking off and traveling to your lungs. And this is a disease of young, otherwise healthy people. For instance, Serena Williams had a DVT with a pulmonary embolus and had to undergo life-saving treatment as a result. Regis Philbin, his name escapes me right now, but one of the NHL players got this. So it's not an uncommon disease, and it happens in otherwise healthy people.
And so what is it exactly? Break it down for us in layman's terms as far as what's going on in the body.
So DVT is when a blood clot forms for a variety of reasons, typically in one of the larger veins of the body, usually from the groin up.
Okay.
What happens then, and that can happen due to a variety of things. You can have a genetic predisposition to forming these things. You can be dehydrated, as in air travel, or drinking a lot when you're dehydrated as a hangover. It can happen most commonly after recent trauma or elective surgery, like Kanye West's mom, who also died from PE. And what happens then is the clot can break off and travel to your lungs. When it lodges in your lungs, it creates an obstruction to the heart. So if you're already predisposed to cardiac disease and your heart can't take that extra workload, it predisposes a heart attack, which happened, I believe, to the Amex CEO, I think as recent as 2 weeks ago.
So what do we do to prevent this?
Things that you can do to prevent DVT are early diagnosis is key, because it rarely happens where the DVT forms and immediately goes to your heart. It can happen, but it's not that common. So if you exhibit signs like leg swelling, especially one-sided leg swelling, leg pain, calf cramping, things like that, that's something that you should go and get an ultrasound scan for to check you for this.
If you are on a plane, let's say you're traveling, what are some, I know they say stand up, right? Stand up and walk around a little bit, which is not always the easiest thing to do on a plane, obviously, but you go up and go back and annoy the flight attendants in the galley.
And you should. You know. There was a case last year where actually on a Delta Airlines flight, there was a guy that was complaining of leg swelling for 6 hours. They were on the tarmac. And it actually turned out that the guy had a DVT and developed a pulmonary embolus while they were sitting on the tarmac, and they did not let him get up and walk. So yes, you should definitely push, to get up and walk if you're having those
problems. Insist if you need to, yeah. Okay, so that's one issue here. Now, briefly before we go, you said there were a handful of other things that you need to be on the lookout for, in particular when you're traveling.
Some of the other things to be on the lookout for is you've got to keep hydrated. So your body is 70% water. If you don't have enough water, everything goes awry. So things like your immune system, for instance, mucous membranes that line your nose, the immune system in your mouth, these things protect you from germs that are in a closed cabin. So the more hydrated you are, the better your immune system works. That's one thing. You should, in general, get up and walk to minimize your chance of blood clots. And you should, in general, if you can, close the blind that actually that exposes you to the sun, because you're very high and you actually have less of a protective barrier against you in the sun's rays, so you have a slightly higher risk of skin cancer, believe it or not.
I never would have thought to do that. They say keep those up on takeoff and landing so that you can be looking at things, right?
Yeah.
To make sure nothing's going on with the plane, but then once you're up safely, when you hear the ding maybe, I always listen for the ding because I'm a scared flyer. It means you've hit 10,000 feet. You can put that down too, huh?
Actually save your skin.
Yeah, I know. Okay, I like that too. All right, get up and stretch, put your shade down, and stay hydrated.
Stay hydrated.
Dr. Greuner, it's been a pleasure.
Thank you so much.
Welcome to the South. Thanks again for coming. We hope you come back.
I appreciate it.
All right, come back with us after the break, too, for more Good Day Charlotte. We'll be right back.